Following my video on acute bronchitis, this is a video on tracheobronchitis. So tracheobronchitis is when you have inflammation of both the trachea and the bronchi. So here's your trachea and here's your bronchus and bronchus on here. So when there's inflammation of the tracheobronchial tree, this looks a bit like an inverted tree, doesn't it? When there's inflammation of the tracheobronchial tree, that is what we call tracheobronchitis. Now, again, just like bronchitis, viral causes are more common, and those viral causes that commonly cause this are rhino and influenza. Rhinovirus and influenza, right, like here. Now, this commonly does occur in both the children and the elderly, or someone who has a bit more of immunosuppressed. And just like acute bronchitis in the last video, this one will also follow an upper airway infection. So this one is also post-infectious. Just like acute bronchitis, this one is also post-infectious. So tracheobronchitis is inflammation of the trachea and the bronchi, and the causes are typically viral. Viral causes are always more common. So this is my pair mnemonic here. P for parainfluenza, A for adenovirus, I for influenza, and R for rhinovirus. These are the causes. Bacterial causes typically are Haemophilus influenza. And remember, this can also target patients who already have an underlying lung disease. Strep pneumo is one of the most common causes. And the management of tracheobronchitis. So remember my ABCO mnemonic. So for all lung conditions and for all lung infections, you can give ABCO. So antibiotics for A, B for bronchodilators, C for corticosteroids, which will always help with the inflammation, and I'll put corticosteroids / cough medicine, and O for oxygen. So whenever you're treating a lung condition, it's going to be one of these four things. So we can give antibiotics, which would be effective for bacterial infections, but not for viral infections. But what use may an antibiotic have? An important use that it may have is that it may prevent a secondary infection. Cough medicine is important, but not so much that you suppress the entire cough, because we want the patient to cough because we want them to bring up mucus and remove the irritants from the lungs, and bronchodilators to open up the tubes.